Hello everyone, this is Savita working in RPIIT Medical and Technical Campus. Today we will discuss on discharge of a client from hospital. Introduction. The patient, the family, medical staff, nursing staff, social worker, dietitian and all work together to coordinate the discharge. The doctor plan the discharge with the patient and leave a written order on the patient chart. The patient may have concern regarding managing own care at home. Provision such as home health care may be needed as ordered. Assessment need to be done as to what help the patient will need at home. Discharge planning involves the entire healthcare team. Types of discharge. There are five types of discharge. First one is planned discharge. Planned discharge, patient completes the initial actual management in the hospital and now he or she need not to be under direct supervision of of that hospital. Dama and Lama discharge, leave against medical advice. Transfer means transfer to another unit or another hospital for a special care. Abscond from hospital, refer for further management. Consent for Dama, in which in Dama we can give a written consent to the hospital, like I am leaving the hospital ward against medical advice. Doctor explain me about my disease condition and ill effects of discharge against medical advice. Doctors and nursing staff will not be responsible for my ill effects happening after my departure. So here we will mention the patient name and relative, relation, signature, date and time. Steps involved in planning discharge planning. First one is evaluation. Evaluation of the patient by qualified personnel, discussion with the patient or his relative, planning for the homecoming or transfer to the other place, determining if caregiver training or for the other sport, referrals to home care agency or appropriate sport, arranging for all follow-ups, appointment or test. Nurse's responsibility is in discharge. During discharge procedure, first one we have to see the doctor's written order and explanation, hand over all personal belongingness of the patient, check and receive any hospital property like blankets and other articles which are using patient during care. Confirm bill paid, inform other departments regarding discharge, arrange transport facility like ambulance. In Dama, we have to check the consent form. Nurse's responsibility in MLC cases. Check for the medico legal history, notify the medical officer in charge, abscond cases immediately consent medical officer in charge, maintain all document in a proper manner, taking the written handing over the taking of articles, never discharge a patient without written order by physician. Checklist in checklist we are using a methods mean M means medication, E in which environment, T means treatment, H means health education, O outpatient referral, D means diet. Nursing responsibility in discharge. After discharge we have to first one we have to complete our documentation. In documentation just we have to maintain the time of the time of discharge. Next one is care of patient unit and articles. Care of unit after discharge. First one is room is cleaned and aired, open the windows and door, all article used should be cleaned. After that, remove hazard like worm, electrical cords, etc. Make sure fire alarm are in working order. Rearrange all articles ready for the next patient. Discharge discard or unwanted things from the unit. Use linen in the send to the laundry. Last is fumigation. Fumigation is total surface exposure to the formaldehyde gas Under the condition of controlled humidity, temperature and the time, exposure will destroy all vegetative form of bacteria, viruses and most of spores. If you want the best result during fumigation, then we have to use above 60 humidity pressure and temperature not less than 18 degree. Next one is carbolization of bed and mattress. Carbolization of bed and mattress purposes prevent the cross infection to keep the bed ready and cleaning and disinfection. Next one is closed bed. After that we have to make a closed bed, a bed which is prepared when there is no patient in the bed. Purposes: keep the bed ready for use at any time, a neat appearance, be prepared for any emergency condition, denote that the bed is vacant, beauty and symmetry of the unit and wall, prevent injury and complication. Thank you.